Hey future nurses, welcome back. I'm Nicole, a nurse here at Blueprint Nursing. Today we're going to talk about a test taking tip and then we'll move on to do a practice NCLEX question. This question is a throwback to one of our other videos about insulin types and administration. Missed that one? No problem. You can try this question out and watch the insulin video after to have a thorough review of the question. And so you never miss a review, subscribe to Blueprint Nursing here and on TikTok. Now let's get into it. So I've always been a huge fan of using the process of elimination. It sounds so simple, but it's gotten me through a lot of NCLEX questions, especially when it comes to questions that I'm unsure about. To practice the process of elimination, start by thoroughly reading the question. Pay attention to keywords or concepts like most or priority. Then, identify and eliminate obviously incorrect options. Trust your nursing judgment here. These can include options that are factually incorrect or contradictory to the standards of safe nursing care. For instance, if an option has a client that's in distress, but you're leaving that client, rule it out. If you get the options down to 2, you've just increased your chances of getting the question correct. For the options that you're stuck between, try your best to spot the subtle differences and flaws here. Like I said, trust your nursing judgment here, and answer the question to the best of your abilities. Okay, let's try this out on a question now. A nurse is educating a client about using insulin therapy. The nurse explains that insulin detamir has a long-lasting effect. Which of the following statements accurately describes the characteristics of insulin detamir? First and foremost, what are our keywords here? I'm looking at accurately, long-lasting, and insulin detamir. It seems like we're talking about an insulin with long-lasting effects. In my head, I'm thinking of intermediate-acting or long-acting insulin, since those two have longer-lasting effects out of the different types of insulin. The question also gives us the name of the insulin, which is insulin detamir. Do you remember what type of insulin that is? Yes, a long-acting insulin. We're looking for a statement that is accurately describing a long-acting insulin. Right off the bat, I have 2 that I want to eliminate. Can you spot them? Options 3 and 4. Option 3 is a characteristic of rapid-acting insulin, and 4 is a characteristic of intermediate-acting insulin. With those 2 eliminated, that leaves us with options 1 and 2. This is where we'll want to look at those flaws and differences. Both options have characteristics that I would think belong to a long-acting insulin, but one of them has a flaw. Can you spot the distractor? That's right, option 2. Long-acting insulins do not have a delayed onset. That leaves us with option 1 as our correct answer. Insulin detamir does not have a peak effect. We remember that these insulins start working within 60 to 120 minutes and last 24 hours. Great job. Here are the references that we used for this review. All right, future nurses, thank you for joining in on this video. Take a look at our other videos for a wide variety of content reviews, and let us know if you have any topics you'd like us to cover. Until then, happy studying.